Hello, welcome to my channel. I'm back. I'm going to teach or discuss to you about um, the the one of the vital signs of our body, which is temperature. I'll discuss which one is normal, which one is high, which one is low temperature, and their medical terms, and what are the factors that's affecting our temperature. Yeah, that's that's it. So first of all, um, I'll tell you the um, temperature, the normal temperature. Measuring a patient's temperature is useful for identifying possible fever, hyperthermia, or hypothermia. Hyperthermia is high temperature, hypothermia is low temperature. Hypo is low, hyper high, thermia is temperature. So yeah. What is normal body temperature? It is 36.5 to 37.5. But it depends on your hospital or organization or your policy which one is normal. It also depends on adult and babies. But 36.5 to 37.5 is adult. But yeah. So there are like things that are affecting our temperature. Um, First one is pregnancy. It is due to metabolism, increase in metabolism, and hormone production. Number two, stress. It is due to sympathetic nervous system being stimulated and increased epinephrine and non non-resorpine secretions. The third one is food and fluid that we drink. It will affect, or it will, yeah, it another factor that will affect our temperature. Number four is physical activity. It's because of our increase in energy and energy expenditure, then sometimes our temperature will go up. Number five, five, time of the day. Sometimes early morning our temperature is low, and in the afternoon our temperature will go up. That's the highest peak of our temperature. Number six, menstrual cycle. Sometimes our body temperature is affected by hormone caused by menstrual cycle. Age. Number seven is age. Older person have difficulty in conserving heat. That's why you will notice the more we get older, the more we want some blanket and all that. Because as we all get older, we have difficulty regulating heat. And babies and young children have less effective heat control mechanisms and therefore have a wider temperature range. Sometimes as well they get cold easily, they get very hot easily. So you need to check their temperature, like the baby's temperature. Okay, so that's the factors that affects the temperature of the body. There's another factor, the use of what thermometer we use, like tympanic, oral temperature. If you check it differently, it will give you different answer as well. Sometimes 1 degree higher, 1 degree less, and 0.3 to 0.6 degrees Celsius difference. So we'll talk about now about fever. Fever, or medical term, pyrexia. Fever, it is more than 38 degrees Celsius, then that is cold fever. Do you know that our body is doing it in purpose to increase our temperature via the hypothalamus? Generally, to respond to infection, so the body will be less inhabitable for infectious agents. So it says our body is doing it in purpose to put our temperature high, so the infectious agents like viruses can't live in our body. So our body will be inhabitable, cannot be lived. They can't. It will become inhabitable, and the virus, they will die off when our temperature is high, which I didn't know that before. A fever may indicate a lot of conditions such as like viral infections, UTI, what else? Pneumonia, ear infection, meningitis. There's a lot of infection that can cause fever or pyrexia. There is another high temperature, which is they called hyperthermia. But this is different. Fever and hyperthermia is different. Unlike fever, hyperthermia is not a response of the body, because as I told you earlier, fever, when our body is responding to infection, then that you'll have fever. But hyperthermia is a failure of the body thermoregulatory system that result in the inability to properly dispel heat. So for example, there is a sun and you're under the sun, so the sun will give you heat. So if your body should automatically dispel heat, like remove heat from your body. But if your body fail to dispel heat, or they call it, if your body they call it thermoregulatory system fail to dispel heat, then you will have hyperthermia. Hyper because it's high. Hyperthermia may be caused by external factors such as excessive environmental heat. So if too much heat from the sun and your body has difficulty like coping up to remove excessive heat, you'll get hyperthermia. Symptoms of hyperthermia may include headache, dizziness, sweating, nausea, vomiting, muscle pains, and cramps and fatigue. There is also a severe hyperthermia. Severe hyperthermia, also known as heat stroke. We all know that, and a lot of people, we see it in the news that somebody will have a heat stroke. So it is when our body reaches 40 degrees Celsius. This is medical emergency that may lead to death or multi-organ failure. Symptoms of heat strokes may be same as less severe hyperthermia, but the only difference is patient might not sweat when they actually having heat stroke. So it's saying that when they are having heat stroke, it is the same as having less severe hyperthermia. But the only difference is if they are having heat stroke, they will not sweat. they are not sweat. They're not gonna sweat. Sometimes they just gonna drop on the floor. Yeah. There there is also another associated hyperthermia related, but high temperature, 40 degrees Celsius. It is called sepsis. Sepsis may be associated with an extremely high fever. If patient come with this high temperature, it is important to determine if they are having severe hypothermia or sepsis. So if the patient has 40 degrees Celsius, we need to determine, are they having hyperthermia, severe hyperthermia, or sepsis. But high temperature is not the only indicator of sepsis. There's a guideline for that. There's a guideline for like sepsis to find out if it's really sepsis or if it's really hyperthermia. It's not because somebody has 40 degrees Celsius. It's considered hyperthermia or sepsis. So yeah, we already talked about fever or pyrexia and hyperthermia. Now we'll talk about hypo, the low. Hypothermia. Hypothermia is defined as the temperature under 35 degrees Celsius. It is most often caused by external factors such as prolonged exposure to cold weather. Sometimes they swim in the icy cold water like lake, and they get hypothermia. Yeah. It is most often caused by external factors such as prolonged exposure to cold weather, which I already said. Other causes are loss of skin integrity. Sometimes if we don't have fat anymore, like it's skin and bone, we will not have we will not have good good temperature, like leveling of temperature, if we are like skin and bone. Skin integrity or trauma, decreased heat production due to the age and dysfunction of the central nervous system. So yeah, hypothermia is a medical emergency as well. Hypothermia is medical emergency that they may lead to cardiac and respiratory system failure and sometimes death. Yeah, that's serious. Hypothermia is very serious. It's 35 degrees Celsius and below, that is considered hypothermia. Symptoms of hypothermia is slurred mumbled speech, like they are saying like that, like, you know, they are also shivering, like weak pulse. They will have weak pulse, slow shallow breathing, very slow and shallow, like sometimes you have to check, are they still breathing? Then maybe you check if they are having hypothermia. And if they are drowsiness, lack of energy, confusion, loss of consciousness, then that's the symptoms of hypothermia. Of course, you will get confused when after you get cold. In extremely severe cases, the patient may go into stupor or become unresponsive. Sometimes if their temperature drops suddenly to below 35, they become unconscious and unresponsive. Experience apnea and display very little signs of life. sometimes when they are like dying, their temperature will go down and they will stop breathing as well. They will have hypothermia and stop breathing. Then that's the signs of end of life. Yeah, if suspected to have hypothermia, it is important to keep the patient warm. So if they have hypothermia, it is very important to keep them warm. Give them blanket. Sometimes you warm up the blanket. Sometimes we have this machine, bear hugger we call it. Bear hugger we call it, and it pumps warm air under the blanket, so their temperature will go up. Because you think hypothermia is just hypothermia, but hypothermia is and deadly, and it can break, or what do you call it, it can lead to cardiac and respiratory system failure. That's serious, is hypothermia. So you should always refer to your organizational policy as well about these things that I'm telling you. You just refer to your hospital policy about it as well, because they have different ways of doing things. And yeah, so this is just disclaimer and just telling you about the normal temperature and the high temperature, the low temperature, and the difference between fever and hyperthermia, because they are different things. Fever is when infection is causing it and your body is reacting. Hyperthermia is if the environment is causing it and your body is failing to react and to remove excess heat. So yeah, that's the conclusion. And hypothermia, it's just low temperature, but it's deadly, as well as hyperthermia, heat stroke. Severe hyperthermia is also deadly. And yeah, so make sure you drink waters and don't go on the sun all the time, so you don't get severe hyperthermia when you are under the sun, because you might just drop on the floor. Yeah, so yeah, that's the thing for today. Thank you for watching this vlog about normal temperature, high temperature, low temperature, hyperthermia versus fever. They are both high temperature, but they are both different, fever and hyperthermia. So yeah, and also when they have when they have 40 degrees Celsius temperature, it doesn't mean that they have it doesn't always mean that they have sepsis or hyperthermia. Many tests that they need to do to check if they are having sepsis or hyperthermia. Depends on the test that they will do. So yeah, thank you for watching and goodbye. Babush. Babushki. Thank you for watching.